Life Talk Radio presents Health and Longevity, the program dedicated to bringing you cutting-edge information and interviews that can change your life. On each edition, nutritionist, registered dietitian, and board-certified anti-aging health practitioner, Dr. John Westerdahl, will show you how to achieve a longer, healthier life using the latest breakthroughs in nutrition, wellness, and lifestyle medicine. And now, here's your host, Dr. John Westerdahl.
Welcome to Health and Longevity. I'm Dr. John Westerdahl. On today's special edition of Health and Longevity, I will be sharing with you part one of a lecture I presented in Honolulu, Hawaii on medicinal herbs and herbal supplements. Tonight we're going to be talking about herbs and supplements. This is a growing area of interest today. How many of you take supplements of some form or another, whether it's herbal or vitamins? Actually, most of the audience, it looks like, is taking some type of supplement. First of all, we're going to talk about herbs. Herbs, of course, are natural medicines. They've been around for a long time, since the beginning of time. This is in the Egyptian drug rooms. Pharmacists were putting together different herbal preparations. Actually, the herbal medicine book, Papyrus Ebers, written 1550 BC, lists many herbal remedies. The Babylonians used herbs as medicines, as part of their spiritual rituals as well. And many times you're going to find that a lot of the herbal products, there is a religious connotation with them as well as a medicinal connotation. And of course, the Chinese for thousands of years have been using herbs. And some of the herbs that are used today, and even medicines that we have today, have their origins from ancient Chinese medicine. You can see some of the herbs there that they use, ginseng and ephedra and other herbs. Hippocrates, who's the father of medicine, used herbs, and of course the ancient Greeks used herbs extensively in their pharmacopoeia. In fact, all our medicines originated, before we had the synthetic medicines, they all originated from plants. And even today, there is much research going on as scientists are going into the jungles, into the areas of South America, into the rainforests, to find new medicines. And the real concern, of course, from an environmental standpoint, is that many of the rainforests are being destroyed. Part of it's in raising animals. You know, they're raising cattle and cutting down the lumber and using that for raising animals. And there's some concern today that some of the plants may become extinct in the rainforest. And who knows, maybe there's a plant there that someday may be the cure for cancer. So more and more research is going on in the area of medicinal plants. And exciting things are coming out of the rainforest as well. In fact, when I lived in San Francisco, there was a pharmaceutical company called Shaman Pharmaceutical Company that their whole mission was to find medicines from the rainforest in the Amazon. Well, a number of years ago, I came across this article, which was very fascinating. It appeared in The Lancet, which is the #1 medical journal in the world. And it pointed out that pharmaceuticals from plants, great potential, but few funds. And it pointed out a number of medicinal plants that have been proven scientifically to be very effective for many different conditions, and that as we look into the whole area of phytochemistry, we're finding that in plants there are wonderful things that have medicinal properties and preventive properties. However, there's not a lot of monies available for doing research on these plants. And part of that here in the United States is because most of our drug monies and drug companies aren't going to spend millions and millions of dollars to study a simple herb that anyone could come up with and use as a medicinal agent. They're only interested in spending research funds on patented medicines, synthetic medicines that they can patent. It's a profit motive type of thing. Now, in Germany, where the medical system is set up differently, they are interested in doing research on herbs. And actually in Germany and parts of Europe, they're much more advanced than the United States in the whole area of medicinal herbs and more scientific about it, and doctors are much more aware of plant medicines. I'm very interested in the area of plant. In fact, my doctoral area of research was in plant-based diets and plant-based medicines in the prevention, treatment, and reversal of diseases. So I think there's a big power in plants that we need to take a look at, not only from a health and nutrition standpoint, but also in a medicinal area as well. Back in 1994, the word phytochemical wasn't that well known, and this Newsweek article made people real aware of the term phytochemicals. And here you see the article, "The Search for the magic bullet, better than vitamins, can phytochemicals prevent cancer? What about antioxidants? I remember when I was a nutrition scientist for a Shaklee Corporation a number of years ago, which is a major vitamin supplement company, I was telling some of my colleagues they think the area of the future is in the whole area of phytochemicals. And some of them laughed at me. They never heard that term before, phytochemicals. They thought that was a kind of a funny name. Well, now almost everyone knows what a phytochemical is. It's a plant-derived chemical. It may have a pharmaceutical benefit or a nutraceutical benefit, nutrition type of benefit. So this is really the new frontier in the area of nutrition today. Let's talk about herbs, and first of all, get some definition of what an herb is. Herbs are different things to different people. The definitions can vary according to the area of personal interest or bias. In botany, it's described as any plant that has a soft stem. In the culinary field, herbs are redefined as something that has aromatic, flavorful compounds that contribute to cuisine or to cooking. In medicine, plants are sources of healing remedies. And as I mentioned, all the medicines originally were from plant-derived or from natural ingredients. Why is it important to learn about herbs? I think it's important because in the plant kingdom, there's wonderful things that have medicinal properties and health properties beyond just the food. So the uses of botanicals, by the way, is increasing. U.S. physicians are not trained in the use of herbs, so that's one reason why physicians as well as lay people need to be more knowledgeable about them. They're widely used in Europe, China, and Asia with a good track record of safety and efficacy. And of course, in those areas of the world, 80% of the medicines that people use worldwide are from natural sources, and most of those are from botanical sources. Often, herbal remedies are safe and effective alternatives to drugs and medicines which may have side effects. These things are mild compounds. Some of them are very effective for treating different conditions, but don't have the side effects that you do have in some of the drug medications, the synthetic medications. Herbal users get their product information, according to the latest research, from friends, family, books, and magazines. This can be good in some ways, but it can be a little scary in other ways because not all those books and magazines and the information they learn from their grandmother or from their aunt is necessarily that scientific or very good information. But that's where most of the people are getting their information on herbs. Not from their doctors, not from scientists, but from these types of publications and friends and family. Now, Dr. Varro Tyler, he came up with the definition as far as the area of medicinal herbs, one that I think is the best definition I've seen. And that is that herbs are crude drugs of vegetable origin used for the treatment of a chronic nature or to attain or maintain a condition of improved health. I think this is the most precise definition for the area of medicinal herbs. Now, in 1997, we spent about $3.5 billion spent on herbal medicines. Now, today, really about $4 billion a year spent on herbal medicines. 1 in 5 prescription drug users also take herbal preparations. And this is of interest that came out in JAMA and also in other leading medical journals when a Dr. Eisenberg he's from Harvard University, he's heading up the complementary medicine department at the School of Medicine there. He estimated that 15 million people who take herbal medicines may be at risk for adverse interactions between their prescription medications and the herbal products. 70% of the patients taking alternative medicines do not disclose this to their doctors. Why do you think? Anyone have an idea? They don't ask, the doctors don't ask, but they don't even tell their doctors because someone has said the doctors don't know much about it, but also many doctors, or I should say patients, are afraid that their doctors are going to make fun of them if they do say that they're taking herbs or they're taking some alternative types of medicines, supplements, or other products. At Castle Medical Center, myself and Mary Arakaki, who is our dietitian, nutritionist on our staff, what we try to let people know is that when you do nutrition counseling with us at our wellness center, that we're very open to herbs and supplements. We want to help people. Unfortunately, in the past, many people were afraid to talk to dietitians about herbs or supplement products because they thought they were going to be scolded for taking them too. Mary and myself believe that all plant-based
vegetarian diet is really the ideal type of diet for health and wellness, but some of these adjuncts can complement a healthy diet. Now, herbs have been categorized as dietary supplements based on the Dietary Supplement Health and Education Act. Unfortunately, supplements are not regulated in the United States, and some of the herbs and phytochemicals are sold as dietary supplements that are not regulated by the FDA. Many herbs, particularly your medicinal herbs, really aren't supplements. There aren't things you should be taking. When you think of a supplement, you think of a vitamin. They're not necessarily safe to be taken every day like a multivitamin. In fact, some of them could be hazardous if you take it every day over a long period of time. Most of the herbs actually are for specific uses when you have special medical indications or you have special health problems that you want to use them for. Now, in Germany, they have what's called the German Commission E, which is their equivalent to our FDA, in which they do regulate herbal products, and I think they do so in a very responsible way. They allow claims to be made for certain herbal preparations that have scientific basis, where they've done studies to show that certain herbs have medicinal benefits, and they allow prescribed claims for those. They also have very strict standards on preparations for herbs. In other words, they have to meet more pharmaceutical grade quality, which I think is important because some of the herbal products on the market today may not be safe. They may not be clean. They may be loaded with pathogenic bacteria. That's what some of our studies showed when we analyzed some of the popular herbal products on the market. They may not be dosed right. In fact, some herbal products on the market may not even contain the herbs that they claim they have in it because the companies didn't test it and screen it and do chemical analysis on the herbs before they were tableted or put into capsules. So I believe that we need some regulation in the herbal area. Now, the German Commission E has put together their own PDR for botanicals, and these are monographs that outline the safety and efficacy of herbs and phytomedicinals. And these are based, as I said, on studies that have been done in Germany, and they have done excellent peer-reviewed, scientific, published studies, many of them double-blind, placebo-controlled studies, to show the safety and efficacy of many medicinal plants. This is a copy of the German Commission E. In the past several years, it has been translated from German into the English language by the American Botanical Council. Mark Blumenthal, who's a good friend of mine, he heads ABC, or the American Botanical Council. They've republished this, so if you're interested in getting a copy of this volume, you can contact the American Botanical Council off the website. It's quite expensive. It is a professional book. It's available also on CD-ROM now as well. There are many considerations that we need to look at when we look at medicinal plants. First of all, they should be evidence-based for safety and efficacy. We need to know the amounts of active ingredients that these plants have, appropriate doses with the expected response to a particular indication, standardized to the German Commission E guidelines that are published in that book. Incidents of adverse effects, we need to be knowledgeable about that. Are there contraindications, or is there drug interactions? Very important to know. And most herbalists and herbal scientists don't really recommend taking herbs during pregnancy or lactation or even with children, but under specific types of uses. Now, of course, there's some herbs that are fine. Like, for instance, ginger is a great herb, medicinal herb for anti-nausea, and women who are pregnant have morning sickness. That's actually a very effective herb in helping them. These are some of the herbs that are considered safe and effective. We'll be talking about a few of them. And having such a broad topic tonight, I'm not going to be able to cover all of them, but there's at least, 200 major herbs that people are using today for different reasons. Probably about 2,000 worldwide altogether, but 200 major medicinal herbs that people think of today. And these are some of them: echinacea, hawthorn, garlic, St. John's wort, valerian, ginseng, milk thistle, saw palmetto, ginkgo are quite safe. On the other hand, some of the herbs that should be avoided and considered unsafe include chaparral. That used to be a big herb for many, many years. People were taking it, but it's been associated with liver toxicity. Comfrey, which can also do damage to the liver and even promote liver cancer. And comfrey externally as an herb contains allantoin, which is a very good wound healing agent externally to put to cuts and so forth, but not safe internally. Geraniander, pennyroyal, All these, there's been several cases of liver toxicity associated with these herbs. Now, ephedra or ma huang was recently pulled off the market, although I think ephedra is one of the greatest medicinal herbs ever in history because of its decongestant properties. However, it's been abused in the herbal industry because it is a stimulating herb used in weight loss aids and energy supplements and so forth. And there have been people that it's raised their blood pressure. People have died from taking large amounts of it over periods of time. So unfortunately, it had to be taken off because of the irresponsibility of some herbal product companies that used it in their formulations. I want to just mention that many companies don't test the herbs. This is an older study, but newer studies have been done confirming the same type of thing, that many of the herbal products, like in case of ginseng, many of the products that they analyze contain little or no ginsenosides, which means that out of 54 commercial products, 60% had little ginseng and 25% had no ginseng in them at all. I want to talk a little bit about Panax ginseng, or ginseng. That's Chinese ginseng or Korean ginseng to start off with, because that's one of the most popular herbs used for increasing energy and improving stamina, reducing fatigue, stress, and mental exhaustion. Some studies have shown that it's helped to lower cholesterol and improve LDL-HDL ratio. Ginseng has been labeled as one that promotes homeostasis or balance and provides resistance to stressful stimuli. And this may be, as a result, it may potentiate the function of the adrenal glands. Ginseng has the longest history of traditional herbal use. Do you know ginseng is the most extensively researched plant on the face of the earth? More research has been done on ginseng than any other plant. And the 6-year-old roots are probably the best quality of ginsengs because they have the highest levels of these compounds we call ginsenosides that are believed to be the active ingredients. Now, there are problems with abuse of ginseng. There's what we've called the ginseng abuse syndrome. People who take large amounts of ginseng over long periods of time, it's been shown to promote hypertension, raise blood pressure, and cardiac disorders, heart palpitations, so that people who have cardiac conditions or high blood pressure should not really take this herb because it can have some adverse effects. Some of the side effects associated with ginseng are nervousness and excitation during the first few days at higher dosages. Overuse can cause headaches, insomnia, and heart palpitations. And this is what we call the ginseng abuse syndrome. This is published in Journal American Medical Association, showing that people that took over 15 grams, which is a large amount of ginseng actually, per day, had some of these types of side effects. If you are taking central nervous system stimulants as part of therapy from doctors, or drink a lot of excess caffeine, ginseng could be contraindicated for those conditions. In pregnancy, it's not recommended for pregnant women. For many years, ginseng was thought to be really good for athletes. You know, it's an ergogenic aid. What does the research really show? Well, the research really doesn't support it too well. In fact, concluded the study does not support the ergogenic effect on peak performance, aerobic exercise. Basically, here again, ginseng had no effect on oxygen consumption and heart rate. Aerobic exercise tests measured pre- and post-trial tests. The studies have not shown it to be very effective at all for athletes. And I know a lot of athletes do take ginseng. Ruth probably knows lots of people out there that take ginseng thinking that's going to give them a boost and be good for them. Even the astronauts in Russia were using it and many others. But it really hasn't shown from a scientific perspective in the studies done to be that effective. Also, ginseng's been known as an aphrodisiac, enhancing sexual vigor and so forth. Here again, very good studies have shown no support for those claims. Dr. Norman Farnsworth, who I work very closely with, in fact, he's world's leading authorities on herbal medicines with the World Health Organization, professor of pharmacognosy at the University of Illinois in Chicago, has done a lot of research on ginseng as well as many, many herbs. And I just want to acquaint you with that word pharmacognosy. Pharmacognosy is one of the 5 disciplines of pharmacology that deals with natural medicines. Pharmacognosy is really the original pharmacology. It has to do with natural medicines, most of them which, of course, come from plants and herbs. Anyway, Dr. Farnsworth did lots of extensive research on ginseng, and I think his comment on ginseng sums it up really good. That nothing is proven in pharmacology until different groups all publish and agree. Ginseng is a perplexing problem. It has been shown to have virtually every conceivable biological effect known to man and woman, and there are reports that most of these effects are also negative. Until some good human studies are done, ginseng must be considered as a general tonic with no specific biological effects that can be nailed down for the human condition. Now we're going to come to one of my favorite herbs, and this is a culinary herb as well as a medicinal herb, and that's garlic. I've become real passionate about garlic because I spent 2 years in researching garlic and studying it. Garlic, of course, has been used as a medicine for many, many years, even back to the ancient Egyptians. By the way, this is the original medical text called Papyrus Ebers, written in 1550 BC, and there's at least 200 medical prescriptions. This is the first medical book, by the way, known to man here. 200 prescriptions that include garlic in its formula. Now, when you look at this papyrus, here's the first medical text in a big way that's been discovered. Anyone see any similarities to what we know today in medicine? Well, what it shows is that doctors' handwriting has not changed. Hippocrates used garlic as a medicine for bronchial conditions, for colds and flu, with children, with adults. Of course, he used many other botanicals too, but garlic was one of the main things he used in his apothecary. I attended this conference back in 1991. It was the first World Congress on the health significance of garlic and garlic constituents, which was at Washington, D.C. 3 days of scientific meetings all about garlic. All the world's great garlic scientists came together, and I was developing a garlic supplement at that time, but before we came out with the formula, I went there to meet with the scientists to hear all the latest research. It was a fascinating program. The only thing that I was disappointed about, all the meals that they served, they didn't have any garlic in it. And I thought they should have included that. And what we know is, from a toxicity standpoint, well, garlic is a food. So, of course, some people do get GI upset with garlic, and some people can have allergic reactions. We do know that garlic is a very powerful anticoagulant. It helps keep the blood thin. That's one of the reasons it's healthy from a heart disease standpoint. It can prevent the blood clotting from taking effect. However, if you're taking medications that are anticoagulants, blood thinning agents, like Coumadin, you're going to have to avoid eating lots of foods with garlic. And the doctors need to be aware of that if you are taking garlic supplements or eat a lot of garlic and you are on blood thinning medications. Most scientists will recommend that you have equivalent to 1 to 2 cloves every day as a good general health and wellness, preventive medicine type of thing as part of your diet. And if you have high blood pressure or high cholesterol, to maybe going to 3 or more cloves a day. Now, let me talk a little bit about some garlic chemistry. When you get a garlic bulb, you go down to the grocery store and pick up a garlic bulb in its entirety and smell it. What does it smell like? You said it. It doesn't smell like anything. What you have to do is you have to take the garlic clove, chop it, crush it, dice it, do something to it, and then the odor is released. And by the way, there are many garlic supplements out there. There's aged garlic extract, garlic oil capsules. This gives you an idea, a little chemistry here. Here's your garlic bulb, and here's a garlic cell. And in the millions of garlic cells that you might find in a clove of garlic, there's 2 separate compartments in the cell, one with an amino acid called alliin, another area of the cell with the enzymes called alanase. And what happens when you do damage to that cell, you crush it, the amino acid comes in contact with the enzyme, and then it forms allicin. And allicin is the active compound that gives garlic its odor. Now, some companies will base their whole garlic supplements based on the allicin content, but that's not a good thing to do because allicin quickly degrades into hundreds of other compounds, and these are other sulfur compounds. In fact, here's some of them. Don't try to write them all down right now. But anyway, these are some of the different sulfur-containing compounds that we have identified, and many of these are believed contribute towards anti-cancer benefits, anti-heart disease things, lowering cholesterol. Some of the compounds, these are all odorful compounds that provide medicinal benefits. Now, what is the best type of garlic supplements? You can eat garlic every day. That's a good thing to do, but most people don't want to do that because of why? They don't want to smell like garlic. I don't know if you've ever been to the Gilroy Garlic Festival and spent a day there eating all day. You smell like garlic for 2 or 3 days. I went there for 2 days once. I was asked to be there because I was the garlic scientist. They had a booth there, and I had to answer information about the science of garlic and all that. But I just went lots of garlic. And 3 days after, I was at the dentist. And I thought it had gone away. I brushed my teeth, took lots of showers, cleaned and everything. And the dentist was across the room, and she hadn't even come up to me yet. And she says, "Oh, did you have garlic for lunch today?" And I had no garlic since that time, but it lingers for a while. Now, when you take the supplements, the garlic oil capsules are probably the ones that are least effective. I don't recommend them because they've been steam distilled. They're mostly inert oil. They've added oil with very little garlic oil that's actually in it. Has no real major allicin-forming compounds. Although there is a strong odor, you can belch up garlic oil capsules very easily. But what's happened is the processing, the high heat, the distillation that's been done, a lot of the important compounds in garlic have been destroyed. Then there's the aged garlic extracts, and they've been studied quite a bit. They are odorless. They're aged 20 months. They cut it up fine and put it in alcohol for about 20 months to try to take out all the odor. But during that processing, a lot of the important natural compounds found in garlic, the phytochemicals, have been lost. And so I don't really believe in the aged garlic extracts. And they are popular. Kyolic is one of the major brands of that. So the best garlic supplements are ones that are made from whole garlic. They're made from garlic powder that has been gently temperature controlled, drying process that retains all the natural constituents of garlic. And they can be tableted in a way that they control the odor, but you don't want to get a product that says odorless, because the odorful compounds are the beneficial parts. So look for the garlic dried powdered products that have been tableted. Those would be the best ones.
You have been listening to Part 1 on my lecture on medicinal herbs and herbal supplements. Tune in next week to Health and Longevity at this same station and same time for Part 2 and the conclusion of this lecture.
To learn more about the books written by our guests and books written or recommended by Dr. Westerdahl in this program, please visit our website at healthandlongevityradio.com. There you can learn how to obtain your copy of these valuable and informative books. Search each page for yourself and see how you can live a happier, healthier, and longer life. Visit us today at healthandlongevityradio.com. Once again, that's healthandlongevityradio.com.
Until next time, this is Dr. John Westerdahl wishing you the best of health and longevity.
This has been Health and Longevity with Dr. John Westerdahl, a production of Life Talk Radio. Join us again next week on the same station and time for Health and Longevity. The preceding information on this program has been general information about your health and is not to be taken as professional medical advice, nor is it intended to serve as a substitute for medical attention. Do not change your diet or exercise habits without guidance from your medical doctor, especially if you have health problems or are on medication. Do not change your medications without the advice and supervision of your medical doctor. If you have a medical condition, we encourage you to seek the consultation of a medical doctor experienced in dietary change and lifestyle medicine. And as always, we wish you the best of health.